Dr. Kim Shepard.
Carrie.
Welcome to the Carrie Croft Show.
Thank you.
I'm really happy you're here.
I'm happy to be here.
So the nervousness versus excitement, what's the percentage?
I'm excited, but this is definitely out of my wheelhouse.
Which I love getting you out of your wheelhouse. Like it gets me like a sick pleasure.
I guess I need stirrups.
To feel comfortable, you need stirrups and vaginas.
Yes.
Right?
Absolutely.
So speaking of vaginas, I'm going to start with this. I'm going to start with like my mind in a gutter, and then we'll elevate to
Everybody should start with vaginas.
Thank
right?
you.
Yeah.
We need to elevate into a better place, but I have to talk about this first. And I did this with Dr. Jane too. But what Dr. Jane was saying, and I do believe this is true, we analyzed this, he doesn't really see the vaginas because he's going all the way in, so he doesn't even look. You know, like, so I bet you if you put 10 photos, he couldn't pick my vagina out of a lineup, right?
Sure. Okay. I would be shocked.
But you,
I'm sure you do have a special vagina.
You've seen it. You've seen my vagina. And you're probably sitting here thinking like, I know exactly what that shit looks like too. I've seen it on an off day. But then he was saying, well, Dr. Shepard's probably seen like more because she has to like she sees it.
Yeah, we look at the whole thing, inside and out.
But you're human. So you have to have looked at a vagina and been like, huh. And when you see someone on the street, you don't ever go, in your mind subconsciously, does it like flash a photo in your head of their vagina ever? It's never happened.
Never. No, I mean, it's kind of analogous to like when you look at somebody, do you think about what their arm looks like?
Well, sometimes like their penis or vagina.
Right, because if you don't see them like all the time, right?
Yeah.
But when you're looking
that's
at
true.
vaginas all the time, it's like looking at somebody's arm or looking at their leg, and they're all different, right? So there's no like one way a vagina should look. So yeah.
But mine's lovely.
Yours is amazing. Yeah.
Most
amazing.
Thank you. I have the best vagina you've ever seen. Okay, now I'm going to get my head out the gutter. Okay. So
I love your head there.
Do you like my head there?
Because I do.
You know what's going to happen? Here's what's going to happen is I say I'm going to get it out, and then 15 minutes from now we're back in.
We slide quickly.
We slide quickly. Which is good, right?
Yeah.
That's what keeps us friends too.
Absolutely.
Right?
Absolutely.
So when you walked in,
Yeah.
you had an I voted.
I did.
So you were not only serious about the voting, but you, because of your schedule, because you're so, your schedule, I still am to this day, I am amazed by you in terms of like your schedule and like the craziness of it, which we'll get to. But let's talk about the voting first.
Yeah.
So the early vote, you went,
Yep.
and let's talk about what you voted for, because I don't think, I could figure it out, but
Right.
let's talk about it.
Yeah, I'm very open about my beliefs. Obviously, they're they're my beliefs, and I 100% respect that everybody has different thoughts and opinions, and I respect that. And even within a medical practice, people have different thoughts and opinions. But I thought that this vote was probably one of the most important votes that we're ever going to have, and not only personally for me and the women that I take care of, but also I think, Ohio right now is in the spotlight. The country is looking at us. We had an article in the New York Times today about Ohio voting, both for issue 1 and for issue 2. But I think it's really important. I think people need to get out and vote, regardless of which way you're voting. I think it's important that we stand up and use your voice for sure.
It's interesting to me because everybody has their signs in their yard and stuff like that. And I don't have a sign in my yard, but clearly I am very much pro women's reproductive rights.
Right.
Period.
Right.
End of story.
I have 2 signs if you need.
Yeah, so I would actually take one. But the signs I'm seeing for people who are saying vote no, have you seen them? So in really big bold, it says protect women's rights.
Right, or protect women.
Well, the one across the street from me says, like, maybe it is protect women. And then underneath it, real small, it says, like, protect family and protect something. But I'm like, that to me, protecting women and their bodies, like, there's really not a gray area here for me.
Right. And so I look at this as like, especially in terms of abortion, it's a very, very complex issue, right? And probably way more so than people even realize. And I feel like that people have tried to reduce this issue down to this issue of morality and right and wrong. And that's so far from, what this is. People all the time think, I know for sure that I would do X, Y, or Z, if I were in a certain situation. But you really, really cannot know what you would do until you're walking in those shoes. And the problem is that there's just so many scenarios, and it's so important that we protect the rights of women to be able to make a decision with their doctor that's going to be best for themselves and their family.
And I feel like you get such a bird's eye view into all of the situations.
Oh, yeah. And the number of times, we've had families who've come in who never in a million years thought that they would make the choice to interrupt a pregnancy, who suddenly are faced with a situation that's the right choice. And if we didn't have that ability, it would be life-changing for those women, those families. We saw when the heartbeat bill passed in Ohio, and we had about 2 months where it was, when it was enacted, it was crazy. Labor and delivery completely changed. We had lawyers that were rounding to try to help doctors navigate what you could and couldn't do for patients. We should never be having lawyers trying to help people make medical decisions. Just like lawmakers shouldn't be, making decisions of what people can and cannot do with their bodies. Those should be decisions that women make with their doctors.
It's actually scary that the thought that it won't go the right way, in my opinion, the right way.
Well, I'll tell you, I still will, and I will always remember the moment when Roe v. Wade, when we found out Roe v. Wade got struck down. I was sitting at my desk in between patients, and I happened to pick up my phone, and there was a New York Times alert that said that it had been struck down. And tears immediately came to my eyes. People have no idea that the impact that this can have.
But you do.
I do. Yeah. I because I live it. And that's the thing that I really try when I talk to people about this issue is that, the right to choose is exactly that. So if the right choice for you is to never terminate a pregnancy, never interrupt a pregnancy, you have that right if we pass issue 1, right? Nobody can ever make you terminate a pregnancy. But don't take away somebody else's right that they don't have any idea what they may choose until they're in that situation. And that's why I think it's so important that people vote yes on issue 1.
Getting back to what I was saying before about your schedule,
Yeah.
And I'm not going to blow smoke here and make you uncomfortable, but I am going to tell you why I have such a respect and adoration for you as a human being, because I have been with you since,
long time.
When was it? Let's take people to the actual. So I lost Angel in 2006. You were my doctor, maybe 2004.
Probably, yeah.
So we've been together quite a long time.
Yeah.
And I am also now your friend. So I see sort of just on a personal friend level, how quick you move and how different every day is and how taxing it must be for you mentally, emotionally. But you have never, ever, and I know people out there will agree with me, you've never made me feel in all of these years, anytime I was in an exam room with you, or unfortunately in lots of other situations, the OR, these delivery rooms, you have never made me feel like you had one thing else on your mind or one other patient in the entire world. Well, and it's such a gift that you have.
I'm just lucky. To be honest with you, I'm just lucky. I love what I do. I love who I take care of. It's a little bit like every day I get to do speed dating. It's but I wish every time I go into a room, I wish I had 15 more minutes, and just to have that time, to spend with people, because I really do just love, the women that I take care of. And so, yeah, I'm very, very lucky.
Yeah, but to actually walk that walk all the time, it's got to be really challenging. I mean, you really feel it all the time. And I feel like that. I feel like every time you walk into the room, it's like you are like nothing else is going on in your world.
Yeah, I mean, it's busy. I mean, I definitely am, but I don't know what I would do if I weren't, right? So I've learned about myself that I don't do idle well. You know,
Yeah.
I need to be moving. And I mean, some days are more challenging than others. And, you know, some days it just seems like everything is very positive and fun. And, you know, you get to catch up with people in their lives and you get to listen to babies and, you know, you get to walk the journey of life with women from, you know, teenage patients that I have all the way up to patients that I have in their 80s. Some days are challenging. You know, people have lost spouses and lost children and, you know, had really hard things happen or dealing with new diagnoses of cancer. And, you know, you those are those days where you just have to kind of stop and be like, you know, this isn't a 10-minute appointment, you know? And so I apologize to everybody when I'm running late, but, you know, those are the things that in one room you might be dealing with. And then you walk into the next room and you've got to be up and positive and excited about their baby. And those are the days where the roller coaster can, at the end of the day, you just kind of like, just need a big deep breath, you know?
Well, because you also have your life to deal with, right? You have 3 boys, and back in the day, you know, when I was kind of, you know, getting to know you, they were all younger. You were married at the time. It had, I mean, and it had to have taken its toll, like, because you have a very sacrificial. I know you probably wouldn't think of it that way, but your career, man, you can't stop, you know, the train of a pregnancy or something bad happening, or you're basically, that comes first on a lot of levels.
Yeah.
How did you manage all of that, and then 3 boys and actually 4, because men, let's be honest, they're another child sometimes.
Well, and I will say my boys always came first.
Yeah.
You know, but they, you know, they're very, very flexible people, and I'm so lucky that I have the 3 kids that I have, because I don't know what I would do if they weren't forgiving of, you know, times where I'd be like, I'm so sorry, but I have to leave. You know, I've got to go take care of this emergency. And I think that at a young age, they kind of understood that what I did was important, you know, and I hope that now, as, you know, they're adults or entering adulthood, that, you know, that they see all of the, you know, things that their future partners can do. And I hope that gives them a different perspective and respect for, you know, whoever they end up with in their life, because they certainly have been troopers kind of going through my busy schedule.
Yeah, because you can't, I mean, you really can't. If something's going on, it has to go on.
Right. Now I have great partners, you know, so I'm obviously I don't, I used to try to do it a little bit more 24/7 than I can probably do now. So I do rely heavily on, you know, great business partners. And it was part of why I, you know, I joined this practice specifically, is that, you know, I had to be in a place where I trusted people, and I knew that if I couldn't be there, you know, that I had partners who would take as good a care of my patients as I would, you know. But I really don't like not being there.
Yeah, and I wonder too, I would love to walk in your shoes for like a week and just experience it all, because I know, like, I'll do what I do, you know, every day or whatever, and then there's days where you're like, I just feel so, you know, tired and exhausted or whatever, but you're dealing with life and death, and you're dealing sometimes with really hard, like my situation alone. I mean, I'm sure I'm probably top 10 of your like most, I don't even know what you want to call me. Like, I don't know many people who have struggled with what I've struggled with. I mean, I know people have gone through way worse. I'm just saying, like, the number of things that have happened in a fertility situation is pretty intense.
Yeah.
But to deal with that stuff and go through that the way we went through, I mean, you were at times, I mean, with Jade and, you know, with Hope, like, you were sometimes more teary than I was. Like literally, like I felt like truly when we were in the room together that you felt it. You were there with me.
Yeah, and probably good or bad. I don't know. I haven't quite figured that out at this point in my life, but I do. I mean, I absorb a lot of it emotionally. So yeah, it does sometimes get a little bit when you have a really tough, emotionally charged week. The end of the week, I'm really glad I'm not on call some weekends, just because you need that ability to reset and to be able to just, or even stepping out of that, and getting together with friends or going out and doing something fun. Those are important things because it does allow you to sort of have that recharge or just getting time with my boys. And now that two of them, are live outside of Ohio, it's, those opportunities that I get to see them and those can be really recharging moments for me.
Oh yeah.
For sure.
And the balance of the bad stuff. So I can think about, like, I can go back to the room we were in with Angel, like it was yesterday, and being in there, not knowing what to expect. And what a intense situation that no one should ever have to go through. But I remember you being there every step of the way, every step. Like I remember, because you have the baby and I couldn't open my eyes. I remember I couldn't open my eyes. I was too scared of what I was going to see. And then I remember Brady running to the bathroom to puke. Like those are two big memories. But I just always remember you steadily being there. I remember, and you probably remember me telling me, like, you asked me if I wanted a popsicle and you wanted to know what color I wanted. And I'm like, this isn't like that seems small, but like you were just there, and I remember at the time your family was going on vacation or whatever, and you were there, it was just.
Well, those are the most challenging points in people's lives, right?
Yeah.
You hope that those are the worst things you ever go through.
Yeah.
And, I think that, I think anybody can help people through the positive things, right? But to be able to have somebody trust you to help them through the hard things, I'm very fortunate that people give me that opportunity, and sadly you do go through so many of these situations with families that sometimes you do have a different perspective that I think sometimes I can help people. It's like, I feel really strongly when people lose a child that they need to see them and they need to hold them. And I hold very strong to the belief that you can't say goodbye until you say hello, and I think that is hard. It's hard for people to do that sometimes, but I think it's also really, really important.
Has anybody ever refused to hold the baby because they just couldn't do it?
We've had people who initially do, and I'm sure people do. I usually really sort of share this experience or share these, messages with families. And even if they're not ready right away, we just keep offering, and it might take them, 15 minutes, an hour, sometimes a couple of hours. But I just think it's really important.
It is. And it's interesting being someone who has been in that room twice. It's scary. It's not it isn't an emotion you would think would come, like you wouldn't hear someone say, well, it's scary. I was scared to open my eyes. I was petrified. Well, it was very
it's terrifying
scary
because you don't know what to expect. Especially with a severely premature baby, is you don't know what's that gonna look like.
Yeah.
And sometimes it is scary.
Yeah.
In certain situations. But I still think, and we really, there are situations where we really try to, position the baby or wrap the baby in a way that makes it less scary, because we don't want that to be the one emotion people have, But I also think, sometimes it can lend understanding, especially when there's physical abnormalities, it can help people understand why this wasn't a healthy pregnancy.
Yeah. Yeah. And then on the flip side, right? So we've gone through some real dark moments together. And then we've gone through some really great moments together, like the birth of Daner,
Yay.
who's like, And so most recently, the surrogate Skye. Let's talk about Skye.
Oh.
So that also, so, you have parlayed into my friend, but I would say that even if you weren't my friend, you still would have, I think, helped me the way you helped me find that surrogate. I mean, you came over, I'm in my darkest of dark, like C-section, depressed. I mean, like opening the crack of the door, like, is anybody out there? And you would sit with me and we would strategize, like, how are we going to make this happen?
Right.
And we did. And I've talked about how we made this happen on the show, so I won't belabor that point. But that day in that room was like, I literally felt like I was elevated above my body. First of all, having Skye and Jason be the most incredible people.
Right.
Shout out to Skye and Jason.
Yeah, absolutely.
And the whole fam. But just that bond and relationship. So we're like next door to each other in these hospital rooms, kind of like going back and forth, which like most people may not do that because it's like, oh, it's the surrogate, it's the mom. We were so interchangeable. And then everything kind of happened so fast. But like seeing you there with her, delivering the baby and it was just like such a high.
Yeah.
And like that reminds you, it's like the cycle, right? The highs and the lows.
Right. Oh yeah. And especially just with your journey. I mean, I think we all needed that moment, I think that, it's such a testament to your bravery, to first have been willing to find a surrogate and it's really empowered me as a physician too, because I feel like I learned through this experience how many people want to help. Like when we put those signs up in the office and I thought, gosh, I don't know, will we get any responses? And I felt like every other day I was, sending you a message. Hey, I just got another email from somebody. And still, even though the signs have been down for a long time, I still have my partners will come in every once in a while and say, a patient came in and, they remembered your signs from last year and, they were interested if you ever have a patient that's looking. And so I have a list of people who have expressed interest in it. And who knows, maybe we'll make more connections for people in the future.
We can start our own surrogacy agency, right?
Girl, we could do that.
Well, and as if you didn't have enough to do, like you offered to be my liaison between these people. I mean, it's like, yeah. And so I'm like, okay, Kim, what? She's like, what should I write back? I'm like, yeah, because you're so bored and have so much time on your hands, like be writing emails for me. I mean, again, just another testament. But, speaking of surrogacy, and I know you probably don't see it all the time, but you've seen it enough.
Yeah, right.
I feel like my experience with surrogacy was because first of all, it took me so long and it was such a long, winding road that by the time I got there, all of the other things I think other mothers probably deal with, I was so over. But I don't want to glaze over those things because getting a surrogate has to be a very emotional thing for someone who really, really wants to carry the baby.
Yeah, it's different for everybody, right? So I've taken care of surrogates who have been surrogates for male gay couples. And I've even had a patient who was the egg donor and the surrogate, which was an interesting situation. Talk about sacrifice, that's huge. I've had people who do it for friends. I have had patients that do it for family members. I've taken care of people who are using surrogates out of state. I've taken care of patients who were the surrogate out of state, so I've seen it in multiple different sort of ways. The thing that I think was really unique about your situation is that you didn't know your surrogate going into it, right? Mm-hmm. But when you met her the first day, and I remember you and I just kept looking at her and each other and being like, is this really as good as it seems? Like, this just seemed like the fact that she came into your life and she was just the perfect person to do this. And I mean, it was just such a blessing.
I mean, we were like, when's the other shoe going to drop? I know. Like, when's the other shoe going to drop? Like, it was something else, right? Yeah. But so some people have asked me if, I've had questions. I've had, have you bonded with the baby the same way because you had a surrogate, or how did that feel? And I know for people, it's probably really hard to sit, because for me, it was otherworldly, and I was like elevated above the room. And I mean, I bet some women are, they have to mourn that part of the experience that they don't get to have.
Yeah, I mean, I think it's similar when families adopt a baby. Mm-hmm. I've had people share with me that, the first, few days they felt like the aunt. They were connected, but not, they were like, is this the way you're supposed to be connected? Mm-hmm. I think after the first week of sleepless nights, most people are like, oh yeah, no, I'm definitely your mom.
Oh, no, they mine. They mine. Yeah. I think we should set the scene for when we did meet Skye the first time, because that was like another out of body experience for me. Because again, I was so emotional, right? I was not okay.
Right.
And, you and I had both decided, I'm like, look, I'm never going to be 100% okay. I have to start this journey. I can't wait till I'm ready.
When you'd really gone full circle from, I'm not going to tell anybody about this.
Correct.
To being like, let's put posters on your wall.
Mm-hmm. Let's put posters and
but
keep
I don't want anybody to know.
Correct.
It's me.
So I talk about this too in the other podcast, but how you were gently trying to spar with me on, you're like, but you have such a great community and SOS, and I know so many people. Why don't you just put it out there? And I just couldn't do it. I mean, it's so weird. It's just my personality. And so we created like this wave one of these, stealthily people who I love, but they have pockets of, people or whatever, which ended up being the right choice.
Right.
But so, Skye is on her way with her family to the house. So I get like a charcuterie and like try to act casual. We are looking out the window, waiting for them to pull up. They pull up and she's got all of her kids with her. I mean, I was like, I don't think I have never had a feeling like that before. I mean, imagine.
Yeah.
I've never had a feeling, oh, here comes this nice family coming up here to see if maybe they'll carry my child. I remember answering the door, and I'm usually like pretty cool with awkward moments. And I think I was, but like inside I was just like, I was mush. I didn't even know how. I'm like, how am I going to get through this conversation?
You couldn't have handled it any better.
We go in the back, and it's a nice day out, like summer, I believe. And we're all around the table outside just talking about everything. I mean, remember how easy it was?
Oh, yeah. And the fact that her kids were like just totally great. I mean, they were fine with it.
I was like, there's got to be something. There's got to be something. I don't understand this. I don't understand it. And then next thing you know, there we were.
Yeah.
And even Skye's experience, she had one miscarriage. Right. So this has been riddled.
Right. Yeah.
Like I look back and I'm
you
like,
don't do anything easy.
Oh my God, no. I'm like, I got some battle scars. You know what I'm saying? I mean, if I look back from I got married in 2005 and this all started in 2006. I mean, think about that.
Oh yeah.
And I don't think I've even been able to totally take a breath and look back and go, wow, like this is actually this journey, that part of the journey is really over. Like, because I've been so busy with, bottles and being up at night and all those things that you do.
It's a lot to process.
It became so anybody who's struggling with infertility knows this. Any kind of medical, I would say, issue, we have to become your own advocate, be organized. You're managing all different things. It truly becomes like another job and another process that you're managing in your life. I mean, there's a lot to that.
Mm-hmm. Well, the IVF process alone is that, right? Mm-hmm. And so then you add to it somebody else carrying your baby, multiple losses, all of those sort of things. I mean, it is truly a roller coaster.
A total roller. Yeah. And you have that times a million every single day going like this, which that's why, back to you and my admiration for you, the way that you're able to do this sort of job with true, you mean the altruism to me, like I've never seen anything like it. Truly. And I just think everyone else out there who knows you is it's like, bravo, yes, well, Dr. Shepard.
You're giving me way too much credit.
Or Shep Dog. And no one else out there is allowed to call you Shep Dog, okay? Except for Caroline, because Caroline coined it. That's hilarious. Imagine you like, now you're going to be like, people will come into
Just call me Dr. Shep Dog.
As long as you call her Dr. Shep Dog, it's totally fine. I mean, I look around at there's so many people in my close circle who are your patients.
Yeah.
Are you even able to accept new patients? How can you possibly have any more room for a patient?
Well, yeah. So actually, when I was pregnant with my youngest child, so 17 years ago, I finally did get to a point where I was like, okay, no more GYN patients, no new GYN patients. And of course, I still take new GYN patients, but I just do it all by referral. So family members, if anybody asks me, doctor referrals, that kind of stuff. So it allowed sort of the slower filter in of new GYN patients. I've always taken new OB patients just because those eventually transition into GYN. But a few years ago, we had a couple of our new partners who joined, and they were getting super busy. And I was like, oh, yeah, I think I'm kind of slowing down a little bit. And I'm like, maybe I'll start taking new GYN patients. So I think I did it about 2 weeks when my office manager came to me, and she's like, could you stop? She goes, this is not working.
Too many.
Okay, too many. So no, I'm very, very lucky. I have a nice busy practice, and like I said, I'm lucky. It's a theme of my life, right? I get to take care of really cool people.
You were definitely born to do this.
I appreciate you saying that.
Definitely.
I definitely never in a million years thought I would be an OB-GYN.
Really?
But yeah, no.
But now here we are.
I know. I look at vaginas all day.
You look at vaginas. We call them vagines. And speaking of busy practices, so Dr. Jane and I were talking about his practice and just fertility in general, and just how it feels like it kind of gotten even bigger or something. Like, and I know, you have the same-sex marriages, like that also adds to it. But do you think that are people just less patient? Like, do you have people who like want to jump into treatments quicker than what you would recommend, or do you think?
Right. I think there's a lot of issues with that. I think women are delaying fertility, which is great. I think people are getting married a little bit later or partnering with someone a little bit later in life. I think you're establishing careers, which is great. But I think that delay in sort of timing of delivery is part of that equation. I think some of it is access. I think there's an expanding access to fertility care. I think that more insurance companies are starting to offer some benefits. It used to be that nobody offered any fertility benefits. And so fortunately now more and more insurance companies are offering oftentimes X amount of money or some fertility treatment. So because of that, I think people are more quick, to move to the infertility realm, treatment realm. So I think it's a combination of factors.
Are more women asking about freezing their eggs?
Yes. Yeah.
Do you highly rec?
I don't. I don't know if you and Dr. Jane talked about this, but my understanding with that is that forever you could freeze sperm, but eggs were pretty hard to freeze. So it really wasn't until probably this last decade or so that you could even freeze your eggs alone without it being an embryo. You can freeze embryos, they're very stable, but it was hard to freeze eggs and maybe harder to defrost eggs and then make it a viable situation to then, fertilize. So I think that was always sort of the challenge with freezing eggs. So up until a certain age, there's probably more success doing in vitro than using a frozen egg and fertilizing it. Mm-hmm. So I think it's like a very careful balance.
Yeah.
Because I think if people, obviously the earlier you freeze your eggs, the healthier those eggs are going to be, the potential that they're going to be healthier. But if you do in vitro, let's say at age 40, you froze your eggs at 35 and you did in vitro at 40, there's probably a higher likelihood of success doing in vitro at 40 than using your frozen eggs at 35.
Interesting.
Right? And I don't know, that's a little bit outside of my wheelhouse, obviously, so I don't want to speak incorrectly about that. But talking to some of the fertility specialists, that's kind of been the guidance that they've given.
Yeah,
me
Dr.
and
Dr. Jane definitely wasn't like, because I was like, well, this is like an insurance policy. He's like,
No.
no. And then he was kind of explaining everybody's different. There's all these variables. You know, sometimes he's recommended people don't freeze them. Like you might meet someone like,
Right.
and then it's not necessarily something everyone should do. But I like that the option's out there, because I do feel like it's really annoying to me how women have this shelf life and
Right.
men can like kind of like live forever,
Right.
as if they have this, you know what I'm saying? Like
Fertility wise.
yes,
Yeah.
but still it's like, you know, it's always like the woman has this clock ticking and the guy's like, yeah, I can knock somebody up when I'm, 64. I'll Alec Baldwin their ass.
How do we evolve out of that?
I don't know. So I like the idea that a woman, should it work out and that she did have frozen eggs, maybe she's just
Gives you control.
Yeah,
Right.
something.
Yeah, I agree. And it's, a lot of people ask me about it, and we definitely, I try to kind of phrase it in this similar sort of situation. I think it's just a hard decision. And there are certain circumstances that I would absolutely recommend it. If somebody is going to be undergoing cancer treatment, at a young age, and we don't know if it'll impact their fertility and they're not with someone, then absolutely freeze your eggs, because we don't know what the future is going to hold in terms of fertility in those situations. But just a 35-year-old who's scared, I don't know that the science with freezing eggs is as good as we think, by what that kind of is. It's not the same as freezing a sperm. It's harder.
Yeah.
Of
course
which
it
is
is
unfair. Right.
Of course it is.
Yeah.
Jesus.
I know.
Come on, universe. Who's the oldest pregnant? Like, what's the oldest age you've seen yourself being pregnant? And don't say me.
50.
Really?
Mm-hmm.
Was it a natural pregnancy?
No.
What's the oldest natural pregnancy?
47.
And does that shock you when that happens?
What shocked her?
Right?
Yeah. I mean, I've had a couple people 45 to 47. And, sometimes it's oftentimes people who've gone through a long fertility journey, people who've done in vitro, or they just think that there's no way that they can get pregnant. And then they do. I had a patient that she had a long, long fertility journey, ended up going out of state to have in vitro, went through multiple losses, finally had a baby. And then she shows up and she's like, I'm in menopause. And I'm like, well, is there any chance you're pregnant? She's like, definitely not. She goes, you know my story. I'm like, I know, but let me just check a pregnancy test just to be safe. Sure enough, she was pregnant.
Was she excited?
And I think she was 46. Oh, yeah.
Yeah.
Yeah. More terrified. But once we knew it was a healthy pregnancy, then excited.
Oh, that's awesome.
Yeah.
Speaking of terrified, so there are times, and you're my doctor too, so I'm like, okay, she's my doctor. They're allowed, like, she doesn't think you're crazy. You're supposed to be asking doctorly questions, right?
Mm-hmm.
But there's been multiple times where I want you to check me for ovarian cancer.
Yeah.
And you've humored me because you're like, if something is in there, it's better safe than sorry. But I have literally said, can you just do an ultrasound of my ovaries? This is multiple times.
Yeah.
And I might be doing that again soon, actually. Because again, I am petrified, as everyone is, of getting cancer. But then ovarian cancer has this silent, like you don't know about it until it's too late. Can we talk about this a little bit more too? Not just for me again, but just for anybody out there.
I love that you're talking about it. My mom had ovarian cancer when she was 55. So
let's talk. My understanding is that once you start feeling something, it's probably progressed pretty far. What are the early symptoms? I mean, first of all, you should be getting your pap
Sure.
every year.
You should be getting an exam every year.
Every
for sure.
year.
You should be getting, and that's part of what there's been a lot of talk about pap smears specifically, and spreading those schedules out in terms of how often should you have a pap. The problem is if you tell somebody, go 3 years or 5 years between your paps, a lot of people don't come in for 3 years or 5 years. And then we miss an opportunity, right? We miss an opportunity to do a breast exam and potentially find a breast mass. We miss the opportunity to do a pelvic exam where sometimes we'll feel an ovarian mass. But ovarian cancer is challenging. The symptoms are nonspecific, so they're the symptoms that every woman has when they're in their, 40s and 50s, which is bloating, sometimes discomfort. And as you said, a lot of times when you get to the more advanced symptoms like difficulty eating or feeling like your belly's getting bigger, those are more advanced signs of cancer. So I think that people have a low threshold. I always say, your body better than anybody else, right? You're the one that lives in your own skin. You know your body. If something feels off, I need to listen to that. Right? That's my job, is to listen to you. And you can learn more from just listening sometimes than you can through lab tests and other things. So if somebody says, you know what, Kim, something doesn't feel right, it might not be gynecologic, but at least we're going to check it out. Yeah. We're going to eliminate that as a possibility. If somebody comes in and they're like, I'm having pain, I'm bloated, I'm like, let's just look. We'll look at your uterus. We look at your ovaries. We just make sure that everything's okay. You know what? And if that's not that, then let's look at what else it can be.
Troubleshoot.
And you got to sometimes just do process of elimination.
Well, when you're doing a regular exam, though, I know you're doing the breast, and then I know you're feeling inside for so you'd be able to feel if there's like a mass in there or whatever.
Sometimes not. Ovaries can be sometimes challenging to feel, just depending on where they are in the body and on the person. Everybody's body is different, and where the ovary sits in the body. So sometimes they're really easy to feel, and sometimes they can be more challenging. And that's where it's important not to just rely on that alone. Where if somebody says, I'm not feeling right, and I'm never going to be egotistical enough to go, well, I don't feel anything, so it's not that. We're going to go, okay, well, what's the next thing that we need to do? What do we need to do? We need to look, right?
What else when you do a regular, like a PAP,
right?
What is that testing for? Like, could you see something else from that specific test without?
Yeah, so when we do an exam, we're doing your pap smear to screen for cervical cancer. And looking for any abnormalities within the vagina, on the cervix itself. When we do a pelvic exam, we're looking at the size of the uterus, the shape of the uterus. Are there fibroids? Is the uterus enlarged? And then feeling for any masses. Do we feel a mass in the pelvis? Is the uterus fixed because there's something going on that's not allowing it to be mobile like it should be? Do we feel a cyst or a mass on the ovary? And so those are all the things that we're looking for.
I feel like I need an ultrasound machine in my house.
Don't do that.
I'm serious, because I feel like there's it's so
like I should call you Tom Cruise.
The body is so scary, because it's like you don't know, and then you start thinking too much about it. Then that's a problem, because you're thinking too much. Now you're worrying, and it's anxiety and it's stress and all that.
Right. No, I agree. It is stressful, and I think as we get older, it's more stressful.
Well, what were your mom's symptoms?
Oh yeah. So my mom lives in Texas, right? So unfortunately, I wasn't around as much, but a lot of it was she just started feeling like she was gaining weight, and then she thought her belly just felt hard, And I even said to her one day, I'm like, Mom, you need to go get checked out. She's like, well, I had my annual checkup. She goes, they didn't see anything, and I'm like, okay, well. So then I was down visiting, and I remember we were out on a walk, and she goes, just sometimes I feel like my belly is really hard. So I touched it, and she was like firm. And I'm like, Mom, you need to go get checked out, because, you could have omental caking, which is like where the cancer infiltrates the omentum, which is the fat pad that overlies the bowel. And, she was like laughing, because she's like, are you saying I have a cake in my belly? And I'm like, Mom, no, this is, it's serious. And, but it wasn't until she got short of breath. So, all of a sudden one day she's just like, I'm having trouble walking up a flight of stairs. And she went in and they thought she had a uterine mass because everything was so hard. And when they did the imaging, it was ovarian.
And so they had to give her like a hysterectomy.
So she had stage 4 ovarian cancer when she was diagnosed. She was 55 years old. And so it was everywhere. I mean, she had a huge amount of fluid in her abdomen. She had fluid in her lungs. And so she did 3 months of chemotherapy. And then, ironically, she was diagnosed the week before I was going to sit for my oral board exams. And, put my oral board exams in good perspective. Right. But I had to go take my oral boards and then fly from Dallas, where we take the boards, to Houston, where my mom was starting her first round of chemotherapy. And then she did 3 months of that. And then she did a big surgery where, they call it a debulking surgery. This is after they've really reduced the cancer. And the doctor told her that, or told us that when he went in, that there was no place he could have touched a pencil eraser and not be touching cancer. They actually had diagnosed her it had eroded through her vagina, and they diagnosed her ovarian cancer through a biopsy of her vagina. So she did the debulking, and then she did another year of chemo. And she was off of chemo for 5 months, and she had a recurrence in her pelvic lymph nodes. So she went in, they took those lymph nodes out, and then she did another year of chemotherapy after that. So she did over 40 rounds of chemotherapy. I mean, talk about a rock star. She worked through all of that. And she's 73 years old.
And she's healthy.
Yeah. Yeah. She's healthy.
I think we need to go to your office after this and do an exam.
We can do it.
I'm serious. I'm feeling like a pain in my lower left side. I'm being serious.
Okay. Well,
do you think it's mental?
Check it out. I think that there's a lot of things that can cause pain on your left side. It doesn't necessarily have to be ovarian cancer. But we'll still take it seriously.
All right. Let's loop back around to the vote. Let's loop back around to voting, shall we?
Absolutely.
Dr. Shepherd. Yes, I love you.
I love you too.
This has been an absolute just joy.
Well, you are a rock star, and I love you so much.
Do you think you'll ever want to come back?
Anytime.
Do you have any?
We can talk about, what do you want to talk about next? Sexual health?
Yeah. Oh, yeah. We can have the people will tell us what they want from you next. Believe me. All right. Yes. And if you're still following your girl out there, please follow me on YouTube, Spotify, Apple, or wherever you get your podcasts. And until next time, go get your exam.
Yes.
Vote yes. And keep moving.
Go to the polls. Go to your gynecologist.